Some people believe drug prohibition exists to protect public health. The idea sounds simple. Certain substances are dangerous, so governments ban them to keep people safe. But when we actually look at the history of drug laws, something strange appears. Some of the most harmful drugs remain legal, while others, with lower risks, become criminal offences, so the pattern doesn't seem to follow harm. In this video, we'll look at how prohibition emerged and why it often had more to do with labour control, racial politics and state authority than with health, because if drug laws were really about protecting people, why are the most dangerous drugs often the ones that remain legal? Drugs and Addiction, an Anarchist Perspective, Dickie Dredd. And we're still on Chapter 3, The Natural Urge to Alter Consciousness, which is part 28 of the video series. Section 26, The Politics of Prohibition. If Section 25 trace the industrial transformation of pleasure into product, this section examines the next turn of the screw, when pleasure itself became suspect. The politics of prohibition were never really about health. They were about hierarchy. Who may alter consciousness and who must remain sober for labour? By the 19th century, the global trade in intoxicants had grown too visible to disguise. Empires built on rum, coffee and opium needed a moral alibi. The rhetoric of temperance and purity provided one. Missionaries condemned the very substances their trading companies exported. Britain's opium wars fought to preserve a narcotic market, coexisted with homegrown crusades against gin and vice. This duality, profit abroad, punishment at home, became the blueprint for modern drug policy. Prohibition served several overlapping functions. It reinforced racial and class boundaries, secured state authority over the body, and redirected social anger away from inequality towards scapegoats. When alcohol was outlawed in the US between 1920 and 1933, enforcement targeted immigrants and the poor, while the wealthy drank privately behind closed doors. In Britain, restrictions on opium and cannabis emerged through colonial panic, fear of the foreign vice corrupting the English worker. The narrative of contamination justified control. At the same time, industrial capitalism required reliable workers. Sobriety became civic duty, not virtue. As Foucault observed, biopower operates by regulating life rather than threatening death, keeping populations efficient, predictable and compliant. The moralising of intoxication dovetailed perfectly with discipline of the factory. The pub was tolerated after hours because it restored obedience by morning. Drugs that challenged productivity, psychedelics, cannabis, opiates, were branded deviant. Those that maintained it, coffee, nicotine, alcohol, stayed legal. The same logic endures. Every government inquiry that claims to protect health ends up protecting hierarchy. Decriminalisation experiments that succeed elsewhere are dismissed as unrealistic, not because the data fail, but because they expose the lie. Portugal's model, which reduced harm through compassion rather than punishment, threatens the very architecture of fear. If citizens can manage their own desires responsibly, the paternal state loses its mandate. Prohibition also thrives on secrecy. Once a behaviour is banned, it becomes profitable. Illegality raises prices and consolidates power in the hands of organised crime, precisely the evil that the law claims to oppose. Marte calls this the addiction of authority. The system depends on the very chaos it condemns. Each crackdown funds the next. The drug war, in embryo, was already present in the temperance tracts and purity leagues of the 19th century. What changed after 1900 was scale. Bureaucracy replaced sermon, medicine replaced morality. The politics of prohibition marked the moment when intoxication passed fully into state management. The church had shamed it, the state pathologised it. Freud's new psychiatry offered a vocabulary for what priests called sin, and incidentally his own enthusiastic cocaine use influenced his early psychiatric ideas on euphoria and self-analysis. The addict replaced the sinner. the clinic replaced the confessional. Both required confession and surrender. The same disciplinary structure, only with whiter coats. Anarchist thought exposes the continuity. Where Section 24 traced the medicalisation of fear, here that process becomes political. Control migrates from pulpit to parliament, from clinic to courtroom. The body remains the territory to be governed. Each time a new drug appears, LSD in the 1960s, MDMA in the 1980s, psychedelics again today, the same choreography repeats: panic, prohibition, profit. Every cycle reaffirms who decides what consciousness may contain. None of this denies harm. Substances can destroy, as surely as they can reveal. But harm has never been the measure. If it were, alcohol and tobacco would be Class A. What prohibition protects is not the body, but the order that feeds on fear. As Foucault noted, where there is power, there is resistance. Yet the two are intertwined. The prohibitionist apparatus keeps rebellion alive precisely by outlawing its tools. The challenge now is to reclaim governance of the self without falling for the next illusion of safety. Chapter 4 will follow the trajectory into the 20th century war on drugs, the industrialisation of moral panic, but the groundwork is already here. The politics of prohibition were never an aberration. They were the logical extension of managed desire. The same hands that sold the sugar learned to police the high. So the issue was never simply the drugs themselves. Prohibition emerged from a system that wanted productive workers, obedient citizens and clear social boundaries. Drug laws become one more way to regulate behaviour and reinforce hierarchy. Once we see that pattern, the debate changes. The question is no longer just what substances are dangerous, but who gets to decide which states of consciousness are allowed. And if prohibition was never really about health, then what happens when societies start questioning the authority behind those rules? In the next section, we follow this story into the 20th century, when prohibition expands into the global war on drugs. Well, in the next chapter, war on drugs. But for now, we'll carry on with this chapter, and we'll continue to probe how modern science looks at the issue. So next up is still chapter 3, the natural urge to alter consciousness, but we're on section 27, the need for altered states, psychology and neuroscience.